Hi, it's Dr. William, and you've heard me talk about likely tissue distensibility. What the hell does that really mean, distensibility? Well, distensibility is just stretchiness. So how much will the tissue distend? And this really comes into play when we're talking about feeling in the hip dips in patients if their tissue is soft enough to accept the fat. So here's a patient that actually has a really nice result that got a good filling of her hips, and I didn't predict that she would really pop out like that. I didn't think that her hip dips were small enough to just totally fix 100% and have her tissue soft enough, but actually it did. I'll show you. I'm gonna have you just turn around here. So she has a really pretty shape. She just has a naturally nice underlying small waist. So these bumps are from the fiber guard. Don't worry about those. But she has a good shape. But this is what I'm just so thrilled about is this here. Because if you look at her preoperative photo, you can see in this part of her preoperative photo that she has some real flatness. And I didn't expect that the fat would be able to distend, to be able to stretch out that tissue. I didn't think the tissue would be compliant enough because there was quite a bit of fat that we had to do to establish the OG line to be able to get that shape. I really needed this to come out quite a long way. And as I was doing the surgery, I was surprised. I'm like, wow, this is coming out. This is awesome. I was super excited. So I'm really happy to see her that this fat has stayed and remained, and it looks good because we're always just trying to get this shape, which is the OG shape. And if you do that, it's nice and natural and pretty. She has pretty good volume here, but she still has a pretty natural shape. She does have one little area here, which is not perfect. You'll see there's a little bit of flatness here. And you can see on her preoperative photo that that would be a predictable area that we probably would have some flatness, but it's pretty minor. I asked her, do you want to see me in 6 months? We can look at putting something there. She's like, no, why would I do that? I don't need that. I have a really pretty shape. My husband's super happy. So I agree. I just like patients to know. So I'm super thrilled because we were able to get good fullness here, even though it looked like the distensibility is going to be low. So sometimes we just don't know. And I've done popper knots in the past, and I think sometimes people think like, oh, you know. I don't know. I really just don't know. And sometimes we get disappointed and I can't fill it as much as I want to establish the line. But here's a perfect example. Somebody that had required quite a bit of filling, had good tissue, I could do it, and she has a really pretty line.